Hello and welcome to the Cancer Interviews podcast. I'm your host, Bruce Morton, and on this segment, we're going to be hearing from a man who not only beat prostate cancer, he decided to write a book about it. He is Jack McCallum of Bethlehem, Pennsylvania, the author of The Prostate Monologues, a book that chronicles the prostate cancer experience of those who survived and the doctors who treated the survivors. It was a very informative read, and you too are going to be informed when you hear what Jack has to say. So let's get started. And Jack, welcome to Cancer Interviews.
Thanks for having me, Bruce.
Jack, all of our interviews end up veering in a slightly different direction because everybody has a different story to tell, but we like to start from the same place, and that is to personalize you a bit, get to know a little bit more about you. So if you would just start off by telling us a bit about where you're from, where you went to school, your life's work, and what you like to do in your leisure time.
Well, that's a lot of territory since I'm not young. I'm 70 years old. I had my prostate intervention when I was 62. By that point, I had been retired or semi-retired from Sports Illustrated, where I was a senior writer for 100 years, as I like to say. I'm still associated there, still on the masthead, still do a lot of stuff. So journalism has been my career, specifically sports journalism. I started out at a few smaller newspapers, got to Sports Illustrated in 1981. So I was lucky. I was there. I was not the reason for it, but I was there during the golden age kind of Sports Illustrated. It was very important. It was very influential. It was a great, great magazine. And I covered basically pro basketball from the mid-1980s on. And once again, I was lucky because I happened to hit the golden era of pro basketball. It was Magic Johnson and Larry Bird were still in the league. Michael Jordan came in, lit another fire. Detroit Pistons, Atlanta Hawks, all these great teams that almost could win it, but yet it was defined by Jordan, Magic, and Larry. And then it culminated kind of my first run with the NBA with the Dream Team. And I was able to write a book about that. And then I took a couple of years off from covering the Dream Team, did some other things, and then went back to the NBA and was fortunate enough to hit another kind of mini renaissance, you know, the coming of LeBron, the great San Antonio Spurs teams. And I was just lucky to have covered that sport. And when I wrote the cancer book, I already had a bunch of sports books behind me. So I really looked upon it as a great opportunity to be informative about it and hope that I was, but also to do something a little bit different from what my career path had been to that point.
Jack, you referenced Sports Illustrated, and I was but an infant when Sports Illustrated came on the scene, but I know that the Luce family and the other people connected with Sports Illustrated wanted to change the way people looked at sports. And yet here you are saying that you were around for the golden age of Sports Illustrated. How did that golden age distinguish itself from other eras in the magazine's existence?
Well, Sports Illustrated started very slowly. I mean, I was around, but I was born in 49. Sports Illustrated was hatched the idea for it in, I'm going to be wrong by a year or two. It was either 54 or 56. I think it was 54. And by that time, Time Magazine, which was the family that it came from, Time Incorporated, Time Life, Time was a behemoth, and Life Magazine was a behemoth. And so they had a lot of operating capital. And there really was, the only other sports magazine was Sport Magazine, which is what I started on. It was a monthly. It was very nuts and bolts. Baseball, basketball, football. It was but it was really a valuable, very well done magazine. But the Henry Luce had this idea that we could do this, you know, more sophisticated, I suppose, and have it be a weekly. Because that was the secret to Time Magazine. It came out every week. It felt almost like a newspaper. You know, things didn't move as fast back then. So you had a weekly magazine, it looked fast. You know, it looked like a little bit like a newspaper. So it was the same kind of idea for Sports Illustrated. But Sports Illustrated started very slowly. And I was not there then. I was too young. I was a teenager by the time it started going on. But what happened was car advertisements. Ford Motor Company decided to sell, I believe, the Thunderbird in Sports Illustrated. They decided, hey, this is a men's magazine. They started piling advertising money. And from what I understand of the history, that's when SI started to take off. And it started to become, in its early days, you look at some of the stuff we covered, dog shows, yachting was a beat. It was literally someone was the yachting reporter. You know, pro basketball, forget it. Baseball was big because of the Yankees and we were in New York. Basketball, not at all. Hockey, not at all. A lot of dog shows, a lot of these precious kind of rich people sports. And so right at the time that the magazine started coalescing with sophisticated men's advertising, the editorial product of the magazine started getting better. You know, boxing matches, pro football, pro baseball, great photography. And so it went on kind of a run from, I'm going to say, the mid-'60s until the mid-2000s that we basically didn't have a competitor. There was nobody that could do what Sports Illustrated could do. There were 35 writers on salary on the masthead. That's unheard of for a magazine. I mean, the New Yorker and National Geographic, you know, they would have like 4 or 5 people on staff. You know, I mean, they were great magazines and they had, you know, a bunch of freelancers, but SI had a budget and a staff of writers and photographers that no one could really match. And I was fortunate enough to have been there during that time.
Now, you said that your coverage with Sports Illustrated focused mostly on pro basketball, but I know enough about Sports Illustrated to know that, and as you mentioned, that it eventually evolved so it was covering all sorts of things. Did you have any oddball, non-pro basketball assignments that stand out as you think back to your time at SI?
Well, the first 4 years, I had come from newspapers. So I was looked at someone who could, when you came from a newspaper, you had a certain reputation, and that was you wrote fast, that you wrote about a lot of different things. Because anybody that started a newspaper, small one like I did, you wrote high school football, high school basketball, high school wrestling, high school swimming meets. You did everything. So my first 3 or 4 years at Sports Illustrated, I used to call myself, I was like the long man out of the bullpen, the guy you called in the 4th inning. You know, I wasn't the glamorous starter. I wasn't the closer. I was the middle guy. And there was a period of time, I think it was 1983 or 84, when I covered 9 different sports in 9 weeks. Pro football, college football, pro basketball, college basketball, indoor track, boxing, hockey, and the World Championship of Squash, which took place at the Yale Club, as I recall, in New York City. And I went to cover it, and I didn't have a sport coat I had to go buy a sport coat to go in to cover the World Championship of Squash, about which I knew nothing, by the way. But one of the secrets of sports writing is that when you cover, somebody used to say, if you cover swimming, the important thing is that nobody ever gets wet in your story. In other words, you got to tell the story of the person rather than the technical idea of, you know, what's going on in the swimming pool. So that was my start at Sports Illustrated, a very wide-ranging map of stuff, and I did a little bit of everything.
Jack, I want to get onto your cancer journey, but just one other question about your time at SI. Obviously, you were around for some great teams in the NBA during your time in which your coverage was heaviest. The Celtics, the Lakers, and then the great run of the Bulls, that that could have been 8 consecutive championships if Michael Jordan didn't take off 2 years for his foray into baseball. Out of all those great teams that you've followed, is there one experience that stands out above all others?
Well, I was very lucky because the first year that I was on the beat, I had happened to be 85, 86. I had done pro basketball before that, but the first year I was really put on the beat. It happened to be the year, probably the Celtics' greatest team. And that team, early in the season, I went to do a story because they had signed Bill Walton. And Bill Walton had been out of the league for a number of years with foot injuries, and he was almost like a Sasquatch type of figure. You know, we knew him from UCLA. Then he had won with the Trailblazers in 1977. And then he had kind of drifted into this anonymity. You know, his foot, he had like, I'm going to screw up the number, but incredible number of foot surgeries, like 27 foot surgery. I mean, he could barely walk. And he at times, and he was coming back to play with the Celtics. And I did a story on him early in training camp. I can still see us sitting out on the grass, and I'm thinking, wow, I'm with this, you know, this college legend, but this guy's not going to make it back. I mean, you know, this isn't going to happen. And that team was just such a magical team for 1 year. They really put it together. Bird was at his absolute best in 85, 86, was never better, was the MVP. McHale was at his best. Robert Parrish and Walton added this kind of strange ingredient off the beach, off the bench, off the beach too, as a matter of fact, sometimes. And he was such a fun character that it sort of set the tone for what the NBA was like then. I mean, it wasn't all fun. It was a job, but it was easy to get your job done. The players understood the role of the press. It was just the best time. Even the superstars that came along had been sort of ingrained under the leadership of Magic Johnson, who came into the league and understood you got to be a good guy. You got to cooperate with the press. You got to cooperate with the fans. We got to sell this league. The league had not been doing well in the 70s. And everybody was on this kind of trip together. They understood if you got on this elevator and it was rising, you could see it, you could feel it. And it was really great to have been around the league at that time. And I got that feeling from the very first moment that I went on as a beat writer.
All right, Jack, let's move on to your cancer journey. Now, quite obviously, there was a time, and thankfully a huge percentage of your life in which prostate cancer was not a part of your life. Can you describe just how life was, more from a health perspective than anything else? Describe how life was just prior to your being diagnosed.
Well, I always kid myself that nothing had been wrong with me except orthopedically. I mean, I had played, you know, pickup basketball and jogging and running and always active and always doing exactly what you shouldn't do, not stretching, not doing the right things to get my body ready for what I always did. So, you know, I had a lot of orthopedic things going on. Back surgery in 1986, both knees scoped around 99. I tore my Achilles near my 50th birthday playing basketball. All these orthopedic things that always happen to be, but nothing really serious. And my wife, who I'd been married to since 1975, was sort of the opposite. Never anything had happened to her orthopedically. She really did the right things, but she had a couple other things. She had Addison's disease that she was diagnosed with. That led to type 1 diabetes. She had all these kind of autoimmune type of struggles, which were daily struggles, which were things you really had to monitor. My life was more screwing up something in my knees and then cleaning it up. So I never really thought about something serious happening to me, even though my father had had cancer. He had had lung cancer. He was a smoker, probably didn't do the things that he needed to do to take care of himself. So I never really put myself in that category. I went to my primary care physician primarily, once a year, something would go wrong. That's all. And I would go to him. But he would always insist I get a physical. He was a very good PCP. We were friends. He understood me. And he always, which involved the digital rectal exam and all the other normal stuff. My heart was always normal. My cholesterol was always under control. But one year, 2000, had gone from 0 up to 4.8 or 9, which is referred to as your velocity. So that's when he became kind of concerned. And when he told me, oh my God, you got to get a biopsy, it was crushing to me, because something like that had never occurred to me. I was always, like I said, the guy that was going to screw up orthopedically, and then I was going to get it fixed, and then I was going to go on. So the first thing I did was schedule a biopsy because of the velocity.
So what were the results of that biopsy?
Well, I went in to have it. The prostate cancer surgeon who had done it was down in Philadelphia. I had gone to college with him. So we were, once again, it was sort of friends type of thing. And I remember saying to my wife, there's just no way I have prostate cancer. I mean, I don't have any. The digital rectal exams had never revealed anything. I did not have any problem with urination. I did not have any problems with erections. None of those things really transfers to whether or not you have prostate cancer. Nevertheless, I was including them. There's nothing wrong down here, was basically my, and my doctor sort of, I don't know why, but kind of said so too. So when my PSA, when it did elevate, was not out of the ballpark. I mean, I don't know whether you have any prostate cancer doctors listen to this. And whenever I talk about prostate cancer and whenever I answer questions about it, I always begin the same way. I'm not a doctor, but my PSA did not go up to 9. It went up to, I think it was 4.8, I believe, but it had been nothing. So I remember distinctly, my wife and I were driving back from the Jersey Shore. We were down the beach in October, and my doctor called me, and he said, hey, I have some results for you. I go, okay, I'm driving. He goes, well, why don't you pull off to the side of the road? So I pulled off the side of the Garden State Parkway, and he told me that I had, had shown signs of cancer in 4 of the 12 sectors that they had taken in the biopsy. I was flabbergasted. I mean, I couldn't believe it, because I just didn't see myself as a guy that had cancer. I saw myself as somebody, like I said, who was really healthy and who had all these orthopedic. My cross to bear was going to be the orthopedic stuff, with my body breaking down from doing too many, energetic things that I should be better prepared for. So, that was the first, when I got that news, that was something then I had to deal with and decide. So.
Now, Jack, we will get into this in greater detail when we talk more about the prostate monologues, but something that kind of sets prostate cancer apart from many other types of cancer is that it just seems to me like there are more variables involved in terms of who's treating you, what type of treatment they they prefer, and what type of treatment option that you follow. What was your chain of events once it was laid out in front of you that you had options as to which way to go?
Yeah, and another option, Bruce, is that whether to get treated at all, which
Right.
is really very confusing to people. I think that's the biggie, because you fall down, you break your arm, you're going to the doctor, right? You bang your head. There's nothing, I can't say there's nothing. I'm not a doctor. I can't say there's anything like it. I mean, I guess the closest thing, what prostate transfers for to a woman is closest to is breast cancer. But I think there's so many deaths from breast cancer, and we know so much about it, that you pretty much get treated. That doesn't mean you get a mastectomy right away, but you better get there. You better get some treatment. Prostate cancer brings a whole different kinds of things. So we started doing research on it, but one of the things that happened to me was, and my wife did a lot of the research right away. I mean, she found out a lot of things. I ended up writing a column for my local newspaper about getting the prostate cancer diagnosis. And the reason I did that was because I'm a writer. You deal with things by writing about them. And B, one of the things we found out was so many people get this diagnosis, and C, there's so much confusion. So I wrote this column for the Sunday paper of the Allentown Morning Call. This was in 2011. I'm sorry, probably 2011. And there was so much response to it, I couldn't believe it. I remember going on they put my email at the end of it. I remember going on my email like on Monday, and there were like dozens and dozens and dozens of responses to it. I mean, just how many people had this thing. And I think it was in the back of my mind then that I would have to write a book about this, because I just saw right away, being a writer, hey, you want a subject where there's a lot of interest. Then I gathered all my treatment options, and I had roughly decided, after talking to my wife, that I would do active surveillance, that I would watch that my prostate cancer numbers were such that the percentages told me, this is only percentages, and that's part of the prostate cancer, the whole metric of it. Probably this wasn't going to kill me in 10 years. I was 62. I was going to be alive in 72. By then I had a grandkid, 2 grandkids with another one on the way. That's what you start thinking of when you get to be that age. You don't really start thinking about yourself. You start thinking about, well, what do I want to see, from my progeny, so that becomes part of your equation. Now, am I going to be alive in 20 years? Well, less of a chance. And part of the other reason to get treated is that there was nothing else wrong with me. In other words, when you go to a prostate cancer doctor, will tell you if you have underlying heart problems, cholesterol problems, you've already had a stroke, you have another type of cancer, lung cancer, which is, can be more, or certainly pancreatic, that is more of a reason to watch it rather than get treated, because the odds are you're going to die from something else. My odds told me I was going to die from prostate cancer because everything else was pretty good. Nevertheless, I had decided I was going to go on active surveillance, but I made an appointment at Johns Hopkins, because by then I had discovered that, like many things in the medical field, Johns Hopkins is where you go and, praise the temple. This is it. This is one of the it places. And I got an appointment. By then I had done some research, and I think I was thinking, hey, I want to write a book about this. And I went down and saw one of their top guys. I still remember I was the last appointment of the day. He had agreed to see me kind of at the end. I think I had talked him into it, probably told him I was thinking about doing this book. He looked at my numbers and he gave me a digital rectal exam and didn't feel anything, but he goes, I wouldn't include you in my active surveillance. You're too young. I wouldn't do it. I said, well, what's the age? He goes, I don't have a set age, but I don't think it's 62. I think you're too young. You could die of this. Do you want to die when you're 80? I mean, it could easily kill you when you're 80. It could kill you when you're 77. It's not going to kill you next year. It's not going to kill you in 5 years. And my opinion changed like that. I remember my wife and I drove home from Baltimore, and I turned to her and went, I'm going to get surgery. It was sort of like that. And I think I was inclined that way also because the thought, active surveillance brings with it a whole different set of, this is no slam dunk. You got to keep getting biopsies. You got to keep getting digital rectal exams. You got to keep going to your doctor. And I had started to learn that all along, infections from the surgeon that I ended up doing the book basically about, who did my surgery, and I'll get to that, told me, for him, this is just his opinion, a robotic surgery for a prostatectomy is safer in terms of infection than doing a biopsy. That the rate of biopsies, infection, is higher than it is for surgery. So I took all those things into account. How I felt about it, how I had previous surgeries, as I said. I was an orthopedic surgery guy, so I had bounced back from them. I wasn't scared of surgery. My wife strongly felt I should get surgery. When I told my two sons I was thinking about doing nothing, active surveillance, they just went, what are you, crazy? So did that figure in that much? Of course. Number 4, did I think that I would bounce back from the surgery? Pretty well. And number 5, yes, the answer to that. Number 5, could I find a surgeon who had done hundreds and thousands of these things that I thought would give me an honest answer on whether I should do it? Somewhere in there with 5% was, would a book be more interesting if I had the surgery? Because this title flew into my mind, The Prostate Monologues. And somebody said, hey, aren't you afraid they're going to confuse it with the vagina monologues? I said, sure, that'd be great.
Marketing.
That's 100 more sales, But I'm being a little facetious, but only a little bit. And when I did all the calculation, I decided that the best thing for me was to get it treated surgically with a robotic prostatectomy with a guy named Dr. David Lee, who was at Penn Presbyterian Hospital, who was in the group of my prostate surgeon that I had talked about, who had given me the biopsy. I just thought, for me, weighing all of those things, and I was a little bit leery of radiation. And as I continued to research the book, I just found there's going to be radiologists out there who are going to say, you're full of it. It's just as safe. For me, my reading of it was, if there was no reason to be treated radiologically, I would rather be treated surgically. Did some of it have to do with the commitment you have to make for radiology? Yeah, it probably does. And I understood that had my cancer escaped the prostate, then I would have to be treated radiologically. They're not going to take out your prostate if the cancer's already in your body. The best guess for mine was that it was not. all things considered, I went in for surgery on February 20th of 2012, and I was glad I did. That's a lot of talking. So,
Jack, I was going to say, so you went with the robotic procedure, which is more in vogue today, if that's the right way to put it. That certainly wasn't around when I underwent my prostate cancer procedure. But you made this decision, and once it was done, how were you?
Well, I was one funny story, Bruce, was I was wrapping up my book about the Dream Team. I was in the middle of doing this book. Not in the middle of it. I was at the end of the project for doing the Dream Team book. And the book was in galleys, meaning it was all finished and printed. You could still make changes, but they didn't love it if you made changes. It was going to cost a little bit of money. And for the for the Dream Team book, I had not yet interviewed Larry Bird. For some reason, even though I got along with Larry, he had escaped me a couple times. I had to cancel one appointment. So the book was all done, except for I didn't have an interview with Larry Bird, and I had interviewed everybody else, all 11 players. Now, there was a lot of Larry in the book, and I could have probably faked it, but it was just bugging the heck out of me that I hadn't got him. And 10 days before my prostate surgery, I called up his secretary for the 17th time. And I said, tell Larry that I'm going in for prostate cancer surgery next week. And if something happens to me on the operating table, my last thought is going to be that Larry blew me off for this book. So I pulled out the prostate cancer surgery card. So Bird gets on the phone. All right, what do you want? What do you want? I said, no, I got to come see you. I got to see you in person. I got to fly out there. It's Friday. I got to be out there on Monday because the next Monday I'm going in for surgery. He says, okay. And I flew out there on Monday, and he was great. I interviewed him. And I remember calling up my editor right after it was over. And I said, look, I got all this stuff from Larry Bird. I'll just make this the last chapter of the book. We don't have to change everything in the middle of it. I can just kind of add this on, and it really fits with what I'm writing about. So the prostate cancer operation did help me get the interview with, the final interview for the Dream Team book. And it does remind me now that I was not yet done the Dream Team book when I decided to do the prostate book. And the Dream Team book came out, and it was very successful. And once you have a success with a book, they kind of want you to, well, why don't you do the next book like that? Keep the momentum going. But I wanted to do my next book, a book about prostate cancer. I'm not a doctor. I'm not famous enough for people care about your cancer. So from the standpoint of a business standpoint, the prostate cancer book was not the best business decision I ever made, as my agent would tell you. But in a way, it's the most satisfying book that I ever did because of this kind of community of people that I met. That, by the way, did not answer your question, but I thought I would just give the Larry Bird pathway because it's somewhat interesting. I can't remember. You asked me about my treatment, I guess, right?
Yes, and it certainly appears as though the procedure was a success. But how did life change for you after that?
Well, I got the procedure on a Monday. I think this is pretty much standard operating procedure now. You have the operation. You wake up with a catheter. You're pretty much released the next day, which I was. You go home with a catheter for I think my appointment was the following Tuesday, so I had it in for 8 days. My wife was an enormous help during this whole thing. It's not easy having a catheter in. I remember walking constantly around the house. I just didn't feel like laying there with this kind of medieval thing inside of you. And I remember one night, I think I put this in the prostate book, circling the arc of the living room here like 137 times just to stay active. And when I went back to get it out, it's no problem. I had a catheter in for one of my other surgical procedures. And, you know, it was not pleasant, but like every technology that has changed, they put it in with a balloon. You don't even know they take it out. And the big thing is going to be you wait at the hospital there to see if you can urinate. And you're allowed to go to the gift shop and, you know, buy a bottle of water. So I remember my wife bought me a bottle of water like this big, and I just, I just chugged this thing because I think it was something like 2 to 3% of the cases they had to recatheterize. You know, if you can't pee. If you can't pee, they're not letting you leave without a catheter. But that had never been my problem. And, I urinated and we left the hospital. I was the happiest person in the world. Now, what happened though, and I don't know whether this is still the treatment, but in order to restore some of your function, I guess, they put you on kind of contraceptive doses of not Viagra, Cialis, the other erection drug. I can't remember what it was, but anyway, I took a dose, whatever the third of the big three is. I took it and had a horrible reaction. That night, the night that I had my catheter out for the first time, was one of the worst nights of my life. I couldn't breathe, a headache, terrible constriction of the blood vessels in my eyes. And I called them up and I said, we have to try something else. And they put me on Cialis because evidently, I'm not a doctor, evidently your reaction to these medications can really vary from person to person. And they put me on Cialis, kind of small doses. And really they said, if you don't want to do it, then don't do it. And that worked pretty good for me. But my reaction to this drug was violent. And to this day, I've heard people tell me that, they take Viagra or Cialis and, well, I don't have any kind of reaction. I kind of do, kind of get a headache, kind of feel it a lot, but they are effective for what they're doing. But anyway, the big thing is urination or your sexual function after, you have a prostatectomy. I mean, that's the most important one is, do you still have cancer? And that's pretty much determined right away, that they say it didn't, they can look and say it did not leave the area of the prostate. So we do not need radiation. You have a prostatectomy that's successful. It's not like you're undergoing chemo or radiation after. They consider the treatment to be that they took out your prostate. That doesn't mean you can't get lung cancer. That doesn't mean you can't get some other kind of cancer. But we treated your prostate cancer and you don't have cancer right now. So the two questions are going to be, urination and sexual function. And urination obviously is determined right away. And you have to determine yourself when you want to attempt, sex again. And I was writing this book. By then I had gotten a contract, a small one. As I said, people would rather have me do something on pro basketball, but I had gotten a contract from Rodale Press to write the prostate cancer book. And, you know, I told my wife that, you know, I'm going to have to write about this. And my wife would be voted least likely person in the world to want details of our private life exposed. But if I was going to do that, I was going to have to write about that. And the other thing about it, though, I'm sorry, is urination is probably a bigger concern, because we do it every day. You know, as you get older, I was now 62. You know, your sexual life is a factor in your life, or it may not be, but it was. But it's not, you know, it's not what it was when you were 22 or 32 or even 42. So urination, there's a lot of attention paid to it. And one of the things you have to be concerned about is leakage. And there's talk about that a lot, you know, that you have times when your urination is spontaneous. You don't know when it's happened. You don't know how you're going to control it. So you better be prepared. You better buy pads. And the trip to the grocery store, which I have, you know, a couple pages in the prostate monologues about, going to that area of the store where the adult, you know, diaper products are, which I don't even know where that was. You know, now I'm over there searching. And that's a very, humiliating is too strong a word, but that's a very sensitive part of the prostate journey. And I think for a lot of men, that's a big deal because of the, you know, obviously psychological, it appears to be a regression. I mean, we started in diapers and then we got out of diapers, and the regression back is, you know, very psychologically difficult. I only wore them for a few days, and it became apparent that it just wasn't going to be a problem for me. And in the 8 years subsequently, have I had moments of spontaneous urination? Yes. Due to the operation? Probably. But have they been significant in my life? No, they have not been. And once again, I'm not a doctor, but the surgeon's ability to spare the nerves that affect sexual function and affect urination obviously are a factor in this whole thing.
Jack, as you look at your physical life today, is there anything you can't do? Do you feel deprived in any way of anything? You feel shortchanged, like there's something I should be able to do now, but I can't?
Well, I do take, I do take medication for sexual performance. At the age of 70, would I be doing that anyway? Quite possibly I would. I don't think, that part of I think that part of your life is a little different than it was, even when you were 60. But that could be that way anyway. Urination for me, fortunately, has been fine. I just had a knee replacement, keeping with my orthopedic journey. Can I blame any of this? I can't blame one thing in my life on having prostate cancer and having an operation. I can't credit it or blame it. However, I just want to make the point that I didn't do anything correct. It wasn't like, oh, I did this great preparation and I'm this great physical specimen. I got lucky. that I had a skillful surgeon, that my conditions going into this, which was sexual function and, ability to urinate, were pretty good going in, because they're not going to be any better coming out. Surgery is not going to improve them. They were both good. I had a partner, my wife, couldn't have been better during this whole thing. And the only thing is that, while I was doing the book, if people read the book, and I hope they do, there are some doctors in there who, I'm not going to say they made fun of me, but they looked at my readings, they looked at my PSA, and they looked at my Gleason score. The Gleason is sort of the amount of, cancer there is, and in many ways more important than the PSA. A Gleason score of in the 7 and 8s scores your cancer as a lot more serious than a 5 or 6. Mine was absolutely at the point where you could have made a legitimate argument for active surveillance. You could have made that argument. And a lot of prostate doctors would have made that argument. Others could have made the other argument that I was at the point when I should have gotten treated. So I was right on that borderline. And right when I was doing the book, the federal agency in charge of sort of regulating medical procedures, that is, when do you get a how often should you get a mastectomy? How often should you get your PSA taken? A lot of those kinds of things that do up the cost of the medical profession, but you would argue on the other side are preventative. The whole idea of preventative medicine, that prostate cancer preventiveness was skewing toward not getting treated, or even not getting your PSA taken, because their idea was that you're going to get your PSA taken, it's going to rise, and somebody's going to tell you to get surgery, and that surgery is going to cost you your sexual life or your continent life, and you didn't have to get it done. Now, I'm not smart enough to have an hour-long conversation about that. All I know is that before PSAs became a regular thing, a regular part of treatment, I think it was the early 90s, Bruce, maybe your history tells you something else. The deaths from prostate cancer were overwhelmingly high. After PSA started to be taken, the death rate went down precipitously. Now, did the rate of unnecessary surgeries go up? Probably. Probably there was some men treated that didn't have to be treated. And probably some surgeons were more aggressive saying, you should be treated than you should have been. That your cancer was more like you had a PSA of 1.8 and it wasn't serious at all. And it wasn't going to kill you for 35 years. But I didn't want to take that chance, number one. And what's happened in the last few years, even since my surgery, was that the idea of identifying cancer that is going to grow, that is going to become lethal, that is the direction of prostate cancer research. To be able to take that PSA reading and that Gleason score and look in there and discern how aggressive it is. And had that been better when I was being scored, would that have made a difference whether I would get treated? I don't know the answer to that, because all I know was that I was on a walk with my wife one night when we were trying to decide about active surveillance or intervention. And I remember stopping and saying to her, every time that I go to the bathroom, or every time that, we're trying to be intimate, all I'm thinking about is that I have cancer. And is that a viable reason to get treated? I don't know, but I'm not going to say that it isn't a viable reason to get treated. And this is an odds game, prostate. Sometimes it isn't. Sometimes it's very, very obvious that you have to get treated. Other times it's obvious that you don't. This vast volume of men in the middle, of which I was one of them, you have to decide yourself, according to what the doctor says, according to what your loved ones say, according to how you feel about surgery, according to how you feel about your lifespan, according to how you feel about how active you are right now. All those weigh into your decisions, and they're sometimes not an easy one.
Yes, it can be part blessing and part curse. Our guest is Jack McCallum of Bethlehem, Pennsylvania. He's the author of The Prostate Monologues. And Jack, I want to talk about your work on this book. I suspect this sort of thing evolved as you went on, but at the very outset, what was the objective of the book?
Well, my joking objective, I always presented it as I wanted to tell the lighter side of cancer. I was being somewhat facetious. But the only way I could write this, the only way my style would allow me to write this, would be if it were kind of a little bit lighter. And even had my cancer had a worse effect, even had I been sort of, let's say that they didn't get everything and they had to go back in, or let's say that it turned out I was heading on a course, it still would have been that tone to it. That was sort of number one. It had a kind of facetious tone to it just because that's the way that I had to write it. Number two, I wanted to, since I'm not famous enough to tell that the journey of Jack McCallum isn't going to be enough to sell a book. And number two, because my outcome wasn't tragic, I had to sort of make it as real person as I could. So my idea was to tell my experience, but in the back of the book, I knew that I was going to interview a bunch of people, get their outcome, interview a bunch of doctors, get their opinion, and I was going to sort of lay out. I had a chapter on my own personal care physician. I had a chapter on my surgeon. I had a chapter on the guy that told me, you shouldn't have gotten surgery. You were fine. I had another chapter on a guy that said, you got to get surgery as soon as you see that velocity go up. So in a way, what I did in the book was sort of illustrate the confusion, because if you look at some of the opinions and some of the outcomes, there's not one particular answer. There's not one surgeon who goes, this is it. This is what you got to do when you're here. Yeah, when you're 65, okay, when you're 65 in one day, you can do active surveillance because you're not going to die till you're 85. But if you're 64 and 306, nobody can do that. You can't do it. So all I could do was gather this. I told my own story in the beginning, and then at the end, I had a lot of anecdotal evidence from friends, people that I had found. I created a email at the end of the book, Jack's, if anybody wants to write me, jacksprostatebook@gmail.com. This was 8 years ago, now 7 years ago. I still get emails. Not every day, not every week, but I've gotten hundreds and hundreds of emails just saying, here was my cancer experience, or I liked your book. It's committed a whole community of people, and as I said, it's not, financially or fame-wise, it was nothing like a couple of my sports books, but it's been a much, much more satisfying feeling doing that prostate book than any other book that I ever did.
Now, Jack, before we go on, one more time, what is that email address?
It is jacksprostatebook@gmail.com. And I remember to look at it once. It's not my regular email, but I remember to look at it at least once every couple of weeks. I went on it this morning before I came on your show, and somebody had an email. And I always begin, if anybody I've written back to who happens to be listening, I'm not a doctor. I start it the same way every time. And research is increasing, all the time. So I hope that, all that is taken into account. But one of the things I found, when I was writing the book was how easily I could get the top people in the world, because the top person at Johns Hopkins, the guy that had first isolated the antigen for the prostate, even Dr. Lou or Chu up in Buffalo, I can't remember, went up to see him. The main guys at Johns Hopkins, how easy I was able to get them, not because of who I was, but because they understand the confusion that comes, seems to ride side saddle with this disease. And I think it's a disease where there's a lot of information about it. There may be a lot of confusion, that's just the nature of it. But there's also a lot of information. There's a lot of resources. As with breast cancer, there's a lot of men that, there's a lot of women with breast cancer. There's a lot of men that have had this disease. So there's a lot of stories. There's a lot of anecdotes. There's a lot out there about this disease.
Jack, you have referenced the survivor piece in this and the doctor piece, the urologist piece, but there's there's one other part of this equation that has lots of variables in it that I would like you to talk about, and that is the P word, politics. Politics manages to bubble to the surface just about everywhere, and as anybody will learn from reading the prostate monologues, politics asserts itself in the overall prostate cancer equation. In your experience, just from what you learned, what are those politics and how do they manifest themselves?
Well, they manifest themselves mostly by, like everybody else, doctors. I'm going to take my personal care physician. He knows me. I've been going to him for 30 years. He kind of knows what he needs to do to treat me. He's seen me all these years. He kind of knows what I want out of life. He's seen my blood pressure, my cholesterol, all these kinds of things. So when it came to prostate cancer, he wants to be able to give me a PSA test if he wants to. The other part of it, though, he's kind of handcuffed, hamstrung, partly allegiant to federal guidelines on what standardized testing has to be. And all that obviously has to do with budgets. All that has to do with how much money is the federal government going to, healthcare. I mean, if we had 13 hours on this podcast, we could, solve healthcare. But all of that figures into what is the budget for these kinds of tests that are preventive medicine. There's a preventive medicine wing of things, and there's a treatment medicine of things. The prostate part of this seems to go up and down. And it seems to have, if you have a senator or a representative who was saved by having prostate intervention, you're going to get somebody who's voting to have a very aggressive preventive medicine philosophy. If you're not that person, and well, wait a minute, I heard And every time there's somebody from the prostate world who says, we treat too many people for this disease, we've overtreated this disease, then that becomes the watchword for a while. And as I said, that was when I was writing the book, that was kind of what was going on. I'm trying to remember the name of the federal organization. You know, it's got 7 letters, the one that the Preventive Medicine Task Force that determines how you should treat these things. And if you recall, this was right before prostate, before I wrote the prostate book, that agency had recommended to reduce the number of breast examinations. It was something like, oh, now a woman shouldn't get it till I'm going to use the wrong figures here, so don't hold me to it. Oh, a woman shouldn't get it now until she's 50. And before it was 40. Well, and the outcry was unbelievable, you know, and it was literally like 3 days later, they changed it. You know, that's pure politics. You know, it's almost according to, you know, who has the greatest lobby in Washington, because it's all about trying to figure out how much money to spend on preventive medicine versus how much money to spend on treatment. As someone who I looked upon it, my life was made better and more secure by taking the preventative measure that I got a PSA test every year. How much money did I spend for 12 PSA tests before one of them showed a velocity, showed a spike? I don't know that, but I was part of the, I was part of the reason that healthcare went up. On the other hand, if I hadn't done it, would I be one of those ones who died in a hospital? And that cost money. You know, you just don't know, but you're right, Bruce. Politics plays a big part of this, federal budgets, and it goes up and down, you know, almost with every new administration that comes in.
Jack, just one other question I want to ask you, and it pertains to something that is sort of in lockstep with what we do at Cancer Interviews. We like to make a point on Cancer Interviews that we do not dispense medical advice, and if you do need medical advice, please seek the expertise of a licensed healthcare professional. And in some ways, you say the same thing in your book, in that you refrain from giving unsolicited advice prior to treatment, and you refrain from being judgmental after somebody else's treatment. That said, I'm going to ask you to make a very athletic move and walk a tightrope. And I
just had a knee replacement, remember? So don't ask me to walk too carefully.
All right. Well, just do your best and stay on top of the tightrope. That said, Jack, can you give somebody a primer in terms of how to go about seeking the best treatment operations? Do that without dispensing medical advice.
I would say if you have cancer in your family, and I'm about to have this argument with my 43-year-old and my 40-year-old son, their chances of getting prostate cancer are more likely than someone else because their father had it and my father had cancer. They are candidates. So my oldest son is 43. Am I going to start haranguing him about going to his primary care physician to get a PSA test? Or maybe the primary care physician, if he trusts him, maybe he says, we're going to start it when you're 50. Maybe he says that. Maybe he says, oh, we should have started it when you were 40. I don't know. Step number 1, just in terms of this type of cancer, I would say go to your primary care guy, get a physical. You don't have to get one every year probably, but get your PSA tested. If you show a velocity in your PSA, I would say get a biopsy. A biopsy is no longer the medieval torture that it was probably when you might have gotten it. You got it, how many years ago did you have?
I got it in late 2000.
Pretty tough, right? I completely wimped out and was put to sleep, which my guy told me you could be put to sleep for the biopsy. Somebody else I know got it recently, said it wasn't that bad. So all that considered, I would say if your primary care physician or a urologist recommends getting a biopsy, I would get it. Number 3, I would take my age into consideration. I would read all the existing literature. Every year things get better. And if a recognized guy tells you that, okay, you have prostate cancer, but it is a really, really negligible, that this is going to turn into something major, because as you know, the old saw, which is true, that if you open up every man over the age of 85, he's going to have some degree of prostate cancer. But if someone tells you early on, well, this is really negligible, let's leave it alone for 5 years and come back to it and see what happens again, I would say that is totally legitimate advice, because the ability every year to tell aggressive from non-aggressive cells gets better and better and better. This is just me. And since you asked me my opinion, what they do with robotic surgery, if you get someone who's skilled at it and who has done thousands and thousands of those surgeries. I got out of surgery on a Monday, came home with the catheter on Tuesday, got the catheter out the following Monday. By the following Friday, there was nothing I couldn't do. I felt nothing. I mean, that type of surgery, I'm not going to say it's negligible. I'm not going to say no one has ever screwed it up. You know, everything is a chance. I'm just going to say, for me and for dozens and dozens of people that I interviewed, that has worked amazingly so. That technology keeps getting better and better. And make sure you get someone who has done thousands and thousands of these things. Now, is there somebody out there, you know, Dr. David Lee, who did mine? There was somebody 20 years ago that was Dr. Lee's first. You know, everybody had somebody, and there was somebody who was his 19th. I happened to be his 1900th or whatever I was. But you can always find somebody who's done it and who has a track record. And I would say if you do that course, that chances are you're going to be fine. Probably don't expect your sex life afterward to be exactly the same, but this is a disease that is preventable. This is a disease that is treatable. It's a disease that there's a lot of information about, unlike other forms of cancer. There's a lot you can do about this disease. So good luck with it, and pay attention to the experts. And I'm not a doctor.
Jack, thanks so much. We've been talking with Jack McCallum of Bethlehem, Pennsylvania, author of The Prostate Monologues. And Jack, before we go, I'm hoping that somebody who's watching this right now is intrigued enough that they want to get the full Monty. They want to get the whole book. And because this book might not be available in bookstores, what's your best advice for someone who would like to pick up The Prostate Monologues?
Well, it was written 7 years ago. And so it's not going, you would only stumble upon it in used bookstores at this point. But the normal course of things, Amazon or Google it, or if anybody wants to talk to me, I would be able to get you the book. I couldn't sell it to you, but I'd be able to find out, where it is. But I'm sure I know that it's on Amazon. But once again, my email address is Jack's Prostate, no apostrophe, bad grammar. Jack's Prostate Book at gmail.com, and I will see your email and I will get back to you.
Okay, Jack. Jack, thanks so much for spending the time with us. We really appreciate it. And I think anybody who has heard you on this segment, they certainly know more about this subject than they did when we began. So once again, thanks so much.
Thank you, Bruce.
And remember, on Cancer Interviews, we want to be with you. And remember, until next time, we'll see you on down the road.
Thanks for joining us today. For more information, please visit us online at cancerinterviews.com. We appreciate you tuning in, and we'll see you back here again next time on the Cancer Interviews Podcast.